Good evening, everyone. Wow, lots of people joining. This is a very important topic. So we'll just give a couple of minutes for everyone to join in. And thank you so much. I hope you can all hear myself and the screen is visible. We'll also be taking questions in this session. So if you have anything you want to, if you have any questions, please feel free to use the functionality to ask your questions. While people are joining in, errors are a very important source of anxiety for many people who are in the reporting field of radiology. And so it's something that we'll be discussing in an interesting way. And so we'll just give everyone one more minute because I can see the participants just numbers increasing very, very quickly. So I don't want people to missing out on. So we'll give people one more minute so that everyone can benefit as much as possible. There will be a recording available as well. But I think if you can hang around till the end, because there's some interesting things which we can discuss, and also it can be a bit more interactive if you're here live. Okay, give me one moment. So we'll just give everybody who's joining in. Just give me one moment. Okay, so I think we'll make a start. So my name is Dr. Syed Junaid. I'm a consultant radiologist in the UK, in South Wales, and one of the lecturers in radiology seminars. But this is actually, a topic relevant to lots of people, especially if you do reporting. The topic we'll be discussing is errors. And as you can see, it's 5 atomic habits to reducing reporting errors. Now, what does that mean? Now, I have an interest in errors because we all make errors. And as a radiologist, one of the things you want to do is do as few errors as possible. I have been involved in errors and discrepancy management within my own department, as well as writing on that subject. And so it's a topic that's dear to myself, but also it's something I think we all need to have an opportunity to learn from. So what we're going to be discussing today is something that I've written on. You can look this up as well. And so I'll be sort of essentially synthesizing that article. And so if you just simply Google 5 atomic habits, it'll show up. And so why are errors important? Because errors, discrepancies, mistakes in the medical field source of anxiety. They are a source of reputational damage. They can cause litigation, patient complaints, reflections. And so it's something that really is essential to ensure that we do as few errors as possible. And the bottom line is the patient is on the receiving end when things go wrong. Now, sometimes mistakes happen because these are human errors. Sometimes they happen because people are careless. It's usually the case that it happens because some form of, not because of carelessness, but other reasons that we'll discuss. So my objective of today is not to give you a system of how you report a specific type of study. So how to reduce errors. It's not how to reduce errors in reporting chest x-rays, for example, or MRI lumbar spine, but actually to give you habits, right? Habits are a really, really important way of managing. Now, as a radiologist, the one thing that we produce, you know, most commonly is a report. The report is our reputation on the line. You know, unlike other specialties, you know, you might have a surgeon or they might see something. It's very difficult to say, and something happens later on. It's very difficult to pin down if that thing was present prior to an operation, for example. But in radiology, it's always there forever for people to criticize. And so if you miss something or if you didn't interpret something properly, that is there forever. And so people can criticize you years later. You know, for example, a physician might feel somebody's abdomen and that turns out to be a tumor later on. They can say, well, it wasn't there when I palpated that abdomen. And so radiology has its pros and cons. And one of the things is that mistakes hang around for a very long time. And the one thing that you have to do as a radiologist or as somebody who reports is manage your reputation. And so my objective is to give you 5 habits which will help maintain your reputation by adding layers of good habits, which will, whatever you report, develop you into a good and safe radiologist. Okay, so why atomic habits, right? So the name, the inspiration came from this book by James Clear called Atomic Habits. And so he describes atomic habits as small habits, but very powerful habits. So remember the atom and the atom bomb is a huge thing, but actually atoms are very small, right? So the small little things which over time make a huge effect. So even in a nuclear reaction, it's a chain reaction that causes a huge amount of energy. And so likewise, if you can develop these 5 habits that I'll be discussing, which we call 5 atomic habits in radiology, I think you'll do well. So this chap, he was the lead coach in British cycling. Now, British cycling, prior to him joining in the early 2000s, wasn't very good. They hadn't won any medals for a long time. And when he came in, Brainsford, and so he introduced the idea of marginal gains. What that means is that little small improvements actually lead to a much higher and better outcome. So he focused on small things that on their own will not make you win the race. Sleep, heated seats, mattresses, and transport, and looking after the bikes. And so each one of those individual things is not going to make you win the race, but actually all of them together and the mindset meant that British cycling has become one of the best cycling teams in the world, winning multiple medals in the Olympics, gold medals, as well as the World Cup. I'm based in Cardiff, and Geraint Thomas, who's a Cardiff local lad who's won Tour de France. And so prior to him joining, the thought, the mindset of British cycling was very different. And that was reached by focusing on detail and small things, but actually all of them together give you the overall win. And that's kind of the mindset I want you to take away, is that having small little good habits is what will reduce your overall error rate. We have, if you make lots of mistakes, especially in the private sector in the UK, your insurance premium goes up, because if you've got lots of complaints and in cases which are pending, you might struggle to get insured. Or if you do get insurance, your premium is going to go up. So all those are real reasons to be a safe radiologist and reduce your overall risk. I will be, from time to time, also be looking at the webinar chat as well. So lots of people are saying hello and hi, and thank you very much for joining in. Okay, so firstly, what are the 5 atomic habits? And then I'm going to, on their own, they need some explaining. And so the 5 habits are: you need to manage distractions. You need to identify your blind spots. You need to find a system to reduce your bias. Do not rush and have a system. Now, I need to explain these in a bit more in depth to actually for this to make sense. Otherwise, on their own, unless you've had some sort of idea of implementing them, that's the key thing, implementing the habits. A habit has to be implemented and has to be done enough times for it to become normal. And one of the things I found as a radiologist when I was training is that many people were would get very upset if someone knocked on the door or the phone went and rang in the middle of the reporting. And they would become really agitated. And it's one of the things that radiologists always complain about is being distracted, being interrupted. Interruptions is, let me just tell you a secret, is part of radiology, right? And so there's nothing new about interruptions. But I came across very few people, if any, who actually had a game plan of managing interruptions, managing distractions. What that meant, because it's a known fact that if you are interrupted multiple times, if you have distractions in your reporting sessions, you are more likely to make mistakes because your focus is lost. It takes time to get your focus back. And so all those things, when we reviewed a lot of discrepancies, one of the key things that came, something was really, really obvious. How could the radiologists miss this great big mass? Were they not looking? It's because they got the phone rang, somebody knocked on the door, a junior radiologist came, asked a question, and multiple things were going on, and they were reporting emergent CT scans. And so very few people, if any, actually have a system of how to manage that chaos. And so you really, rather than being led in that process in a passive way and being pulled in different directions, you need to have an active process, have everything pre-planned and not be reactive, right? And that will actually reduce your stress level, right? So especially when you are reporting acute work, emergency work, or when you've got a lot of reporting to do and time is short, you need to really have a system. And actually, being distracted and disrupted and interrupted is what will keep us in our jobs. Because remember, AI is a threat to many works in radiology. And so the human interaction, we need that. That's part of our job safety. So do not think of it as a bad thing. So if you're interrupted, it's not bad because they value your personal time. But you just need to have a way of managing that. And so one of the things I kind of apply, and I have really encouraged a lot of my trainees to do, is, and you can actually, this is just an example, right? So it's not a clear-cut way of doing it, but something that you can try. And it's called the 2-minute and 10-minute rule. So for example, if I am interrupted by a phone call or a colleague suddenly enters, right? What you don't want to do is not give any mental engagement to what's going on, because you might be in the middle of something. You might be reporting a very, very important, subtle thing, and your mind is there, you're focused, and suddenly somebody just walks in, or the phone rings. And then what you don't want to do is let go of your thought, because that's really much more important than somebody in front of your door. So you need to make that decision instantly, right? Without even engaging. So often, depending on what it is, if I'm covering acutes, so obviously somebody's going to be coming in requesting imaging, so I will not even speak to them, engage with them. All I say is, give me 2 minutes. So they know, right, fine, Dr. Junaid is just finishing off what he's doing. So that normally that means is that I will tie off the bit I'm doing it. Imagine you're doing a abdo-pelvis CT and you're looking at the liver. So I'll finish off the liver bit, okay, finishing up, and then I'll make a note on a piece of paper, I'm at the liver. And if there's something important I was thinking about, right? So, he's got something interesting, and you mentally think, well, I'm going to mention that in my report at the end. I'll write those few little quick things down, and then I'll say, yes, how can I help you, right? If the phone goes off, right, I'll say, just give me 2 minutes. So they know. I don't even know who it is. It could be the Prime Minister. right? Don't you just say, give me 2 minutes. And so they know that, doesn't have to be 2 minutes. It can even be 3 minutes, but at least nothing's going to crash in that time. So that way you are mentally putting your mind at a pause. You're writing down, have a piece of paper, write down where you were. Now, if it's something else, which is non-urgent, so somebody I know doesn't want something right away, I'll just tell them, just give me 10 minutes. So they'll go away and come back. If I see if on my phone, I can tell who's calling. If it's someone I know, actually, they can wait. I'll just quickly say, excuse me, just give me 10 minutes. I'm not even going to engage, right? What is it about? Or can you just give me 10 minutes? Can you call me back in 10 minutes? Or just give me your number, I'll call you back in 10 minutes. So you just take the extension number or whatever, boom. Don't engage. And all of those time, I'm trying, and then you finish your report, and then you have a natural pause. The 10 minutes can be 13, 14, 15 minutes, but that person at least knows. And what happens is, you need to do this a few times, because then the people around you will respect your boundaries. Okay, they know that when I go and can you imagine, right? Somebody's doing a ward round, and you just walk in the middle of examining a patient, listening to the heart, and you just walk in. So you'll naturally wait for you wouldn't do that. And so, as radiologists, we need to really create that environment around us, which keeps our mental sanity, because you don't want to miss things, and also provide the clinical contact that we need. Okay. So I always keep a piece of paper. I've got tons of paper and notes everywhere, because once I'm done, I'll throw them away. But those are really, really important. Piece of paper goes a long way, right? Because sometimes, for example, there's one case I remember. I was scrolling through a MRI lumbar spine, and I saw a AAA, abdominal aneurysm. Now it's not something that's done for us. Oh wow! And I felt really good. I've picked up, and you can only really see it really well on the scout imaging. And then I got interrupted. People came in, and all this an emergency case came in. Can you even look at the scan? And middle of looking at it, I went back, and I completely missed mentioning the AAA. And then a few cases later, I went, oh, that AAA. I went back and made an addendum. But the point is that you need to make a habit, and I kind of, this is first lesson for myself, is that actually I developed this whole system just for my own sanity, and I think a lot of people have found it really, really useful. So that's the first habit done. And actually, if you look at the paper, the article, there are a few more things I discussed, but the key thing is, whatever you do, have a system. You are in charge of managing those interactions. If it means that you're really fiddly with your phone, put it on flight mode. Put your phone away in your bag, because if your phone keeps going off, you get rings and dings, and you get notifications. All those things are going to be distracting you. So you need to kind of manage, but have a system in which you do that. Habit number 2, and it's really important, is identifying your blind spot. Now, the blind spot is a cognitive gap. It's a cognitive blind spot. And it's something that changes and evolves with time. So, and I'll explain what that means. So therefore, what you need to do is, if something's always moving, it needs to be, it's just a bit like swimming, right? You have to keep moving your arms and legs to stay afloat. Likewise, the cognitive gap, blind spots, will move around. I'll give you an example. Okay. You have a blind spot of not looking at the localizers, MRIs, for example. You have a localizing image, or the scout imaging, or the planning imaging. And you keep looking, and you never look at them. And nothing ever happened. And one day, a big tumor is seen on the liver. You didn't look at it. Patient, a few days later or a few months later, presents with a CT and with a big mass in the liver. We look at the prior imaging, and there's a big mass which you can see on the localizer image. Now, this is actually, I'm taking the real case from someone. What that means is that not reviewing the localizer was your blind spot. The only way it got uncovered is because you missed something and somebody else uncovered it for you in an embarrassing way. So you don't want other people to uncover your blind spots by you missing things. You want to find them out before you miss things. And so that's a blind spot. It can be a blind spot in knowledge. It can be a blind spot in where you search for things or your review areas. These can all be blind spots. And so as a trainee, as a resident in radiology, you are very lucky because your consultants or your trainers will help uncover your blind spots, because you'll send them the report and they'll look at your report and they say, yeah, actually you've missed this bit, and okay, I didn't review it properly. And so, but once you become an independent practitioner in reporting, those opportunities become less. And so how do you find out your blind spot? And that blind spot keeps changing. Now for the individual who, for example, suddenly missed this great big tumor on a localizing image, for the next 50 images scanned, the first thing he's going to look at is this localizer, because it made him miss an important finding and may have caused a lot of stress and anxiety and complaint and whatever. Almost kind of burns you, right? So you're very, very careful. But that effect, human beings as what we are, we lose interest over time and become complacent. And so just like swimming, you've got to keep up with your blind spots. And it may be that focusing on that new localizer means that that person is now missing something else. And so a few ways of kind of things that we've kind of suggested, and something that I generally do, and I say this to everyone, even somebody asks me to review a scan. For example, I'll have a colleague, they'll say, Said, can you have a look at this scan? What do you think? I say, just don't tell me the history. Just let me look at the imaging. And I look at it and say, because you don't want to, I want to know, am I missing something that they've not seen? Or am I missing something that they have seen? For example, imagine and one of the things I always tend to do is not look at the clinical history first. Just review the imaging blind, even if it's for a few seconds, right? So imagine you've got a chest x-ray, right? And you look at just first few seconds looking at what's going on, right? Yeah, it looks normal. You look at the history, it says follow-up of lung nodule, or actually that's a good, not a good, query sternoclavicular joint or AC joint pathology. And you think, the AC joint is abnormal. I missed that on my initial review. So that way, you are uncovering a blind spot, right? Had you just looked at this question, how's the AC joint looking? It looks okay. But maybe in your normal review, you would have missed that AC joint. And so that way, I always, for example, I would look at the scan first. I say, what does this look like? I can't see a lot. And then, on the CT scan, small little nodule picked up on the adrenal gland. I missed that. And so it helps you identify that your system has got some holes in it which needs filling up. And so that's a really, really important. That's something you can do every day. Okay. Other things that are useful is in our department and in most of UK, there's something called the READ or REALM meeting, where it makes discrepancies actually a learning process. And ideally, you want to seek peer feedback on your reports and conduct peer reviews. Now, that's not easy in real life. Now, a lot of the teleradiology companies, many of them have a minimum of about 5% peer review, right? So they will peer review 5% of cases, and that's really, really good. That you've got somebody, but that's almost impractical in many workforces. But wouldn't it be fantastic? And if you can't do it voluntarily. Find an ally in the department who you think will actually give you constructive feedback on your reports. And so it's really important for doing these above things, which will actually help. One of the other things I find quite useful, again, is just pick up a random scan which has already been reported by somebody who's a good radiologist and you trust their reports, and just quickly look at the scan, right? And think, well, what do you think? What do you think is going? And then look at what they have reported it like. And that way, they might say certain things, or they might have described certain things that you don't normally do. And that will also open things up. And I always do that. And I say, actually, I really like this, the way this person has described that. And I wouldn't normally have done it that way. And so it's a constant learning process. And so really, as long as you are actively searching your blind spot, you'll do well, right? So the first habit was how to manage distractions and interruptions. Second is having ways to uncover your cognitive blind spot. And that's very, very closely linked to the next habit, which is reducing bias in your reports. The number of times I'm on various MDTs, and many radiologists are part of multidisciplinary meetings, is you pick up often the biases that you often see much later on that have been left in reports. It may be that you are misled by the radiology form. I've had cases where it's a CT head and it said it's got the sides wrong. So it said left-sided weakness. So everybody's looking at the left side and they focus on the wrong side because they're misled by the incorrect information. Patients can have other things going wrong with them. And because the history might say, it's talking about trauma, and you're fixated on finding the trauma-related things, but actually the patient's got a little tumor in the colon, which because you are in trauma mindset in that reporting, you miss that. So often the radiologist, so try to get a blind review of imaging. Also, biases carry forward. So I've had cases where it said, 2-year follow-up, they've had 6 monthly scans for a specific thing, and someone in the beginning has called it malignant or low grade or some sort of malignancy, and it keeps getting followed up and it looks the same. And then when you look at it in a unbiased way, you think, well, this looks completely benign. But every other person just keeps referring to the original report without engaging, rather than saying this is a whatever, they keep believing the previous person, and it's happened the other way around. So you can have something which is benign called malignant and malignant called benign, and that bias keeps going forward. So try to look at it in an unbiased way. One of the other sources of these is a good trainee. So if you've got good residents or senior residents, they will give you a really nice report. They're coming close to becoming a consultant, and you just kind of look at their report and then look at the images, and you're trying to fit their report onto the imaging. It should be the other way around, right? You review the images independently of their report, and then you agree or not. Because we're human beings. We like shortcuts. We like quick things, right? The whole point of a senior trainee or resident is to make your life easy. And you think, well, their reports must be good, and so you think, yeah, I agree with what you said, but actually, and so one of the data that we have is that one of the biggest sources of discrepancies is the trainees, because the consultant hasn't really criticized the report or the imaging properly. And so really try to look at the imaging and make up your own mind independent of all the noise around the scan. So we've talked about the 3 habits, and then the other 4th habit, actually, which is getting more and more prevalent in radiology, is rushing. Do not rush, right? If you rush now, you've got to pay later, partly because of the push of teleradiology work, which is pay per scan, fee for service. So you can sit for 10 hours and report 1 scan, you'll only get paid for 1 scan, right? Whereas you can sit for 1 hour and report 30 scans, you're going to be paid for 30 scans, right? You're not paid by the time. And so people, and that's one element of it. The other element is simply you've got a lot of work and has to get, the radiology departments are under a lot of pressure to get work done. There's cancer reporting to be done, which is high volume. Patients have got scans booked, they've got the treatment awaiting, they've got clinics booked. And so, but rushing, because remember, when you're rushing, something goes wrong, you will never be able to defend that, there was a big list of patients I was trying to get through. Because if you rush now, for whatever reason, first for financial reasons, because you want to get through as much as possible, or because there's just so much work, you're going to often end up paying later. So you you're saving time now, but actually you'll use up time later making corrections, addendums, spelling mistakes, complaints, litigation, all those sort of things will come back and often, would eat up more time later on. And then you might end up using 4 or 5 hours trying to sort out a mess, which you try to save a few minutes. Something that you might have come across before is something called the HALT principle. I've slightly modified it, but recognize. So this is self-inspection of actually being mentally aware, whether when you're on, especially when doing busy work. If you're hungry, angry, you're being annoyed by somebody, you've had an argument with someone from a different department, you're late or tired, and often you have all of those in the mix, especially when you're reporting urgent stuff, on calls and things. And so if you recognize, you're more likely to make mistakes, right? And so just take an extra care, try to knock as few of these as possible, as many of these as possible. Right, here's a quiz. Who can tell me, put on the chat, where is this from? Anyone? So I'm waiting for someone to put me, where is this scene from? Obviously, it's somebody taking the penalty. World Cup final. Excellent. So this is the penalty that won the World Cup for Argentina. Yes, excellent. Argentina World Cup final, right? So this player is not, can you imagine for this player the amount of pressure on his shoulders? No one in their right mind would want to be him, right? Imagine you miss that penalty. Well, if you get it right, amazing, right? But the pressure from your own country, the crowd, the noise, it's naturally human to be under that immense pressure. So when he's taking that penalty, everything he's doing is pre-planned. It's already been done so many times that he does not have to think, that his foot lands exactly in the right place on the ball travels exactly where he wants it to go, and he can completely ignore the rest of what's going around him because he's done it so many times that even if his mind is all over the place from this anxiety, but the physical body will just do because he's done it exactly. So someone's got it right. It's Gonzalo Montiel in 2022. And so this happens because it's been practiced. And it's a well-oiled system, right? And that's why. So this is what you really want to do, is his fifth habit is have a system. This is such an important thing. Because imagine you are going to do an emergency on-call work, right? You've got an emergency list, right? I don't know how many places are hospitals. Acute on-call work is universally busy. It's acute work, inpatient, emergency, accident, casualty patients, surgical patients, orthopedic patients. So trauma calls, post-operative complications, all these things are coming in, and you are the radiologist in charge for the day for that work. So it's high pressure, high stakes. So going in, you have to be prepared beforehand. The preparation for that on-call has already happened beforehand. If you're going to prepare on the day, you're going to miss the goal, right? You're going to perform badly. You're going to be stressing out, and you will have a terrible time. There are lots of people who, one of the things they really, really dread in their job, depending on where you work, is the on-call. It's depending on what sort of on-call you've got, whether it's overnight cover, daytime cover, whatever. For some people, it's very stressful. So the the key thing in all of this is you need to have a system that works in challenging situations, right? What does that mean? If you have a good system, you will be able to also reduce the impact of interruptions. Just like he's about to score a goal and all this stuff is happening around him. The noise of the crowd, the mind, the heart is racing, right? The adrenaline is as high as it has ever been. But all of those will be negated to a greater degree if you've got a good system, just like that footballer, right? And he has practice in good times for it to be useful in stressful times. So let's take an example of an acute CT abdomen pelvis. You need to have a system whichever way it is, right? You might look at the bones first, or the organs first, or for fluid, or whatever system you have. But you need to just, once you're happy that it covers everything, right? It makes sure it covers all the review areas, covers areas that people generally tend to miss. Then, once you're happy with the system, you need to do it so many times that you can do it with your eyes closed. Because if I gave you 1 day to report 1 scan, you'll be fine. Because you don't even need a system. You just keep looking at it enough times. If you're a radiologist, eventually cover everything, right? But when you've got limited time, you've got to get through things very, very quickly in a systematic way. If you're all over the place, sometimes looking at this, sometimes looking at that, and you don't have a system, and that system is developed when things are normal, right? Things are calm. You're doing outpatient work, or you're doing work which is low stress. Even if it's normal, it could be a abdominal pain, and you for a 25-year-old, and you look at the scan, looks nearly normal. You still follow your system, right? Because that system you're doing now is to ingrain in the brain. So when the environment becomes stressful, you automatically do it. And also what it does is that when you have a system, you can pause, deal with interruption, and then resume, right? If your system is all over the place, you become stressful again. And think, I'm going to start again. Where was I? Was I looking at the bones? Was I looking at the lungs? Start again. And then you start looking, and you get interrupted, and then, and you get this cognitive breakdown in your brain, which really causes stress. And if you've got a system, right, you're like, fine, right, I'm halfway through my system. Somebody, give me 2 minutes. Right, you're going, okay, I'm on the bones right now. There was something in the aorta to review. Yes, how can I help? Blah, blah, blah. Right, I've done this. Carry on. So you do that, and that way you get through the scan in a good time. But that system needs to be done so many times for the different things you do that it becomes cognitive muscle memory. And because what are you doing? One of the things you're doing is you're reducing decision-making load, right? Just like the football, he's not making the decisions there and then, right? The decision's already been made in practice, right? When you have this situation, the managers would have already had that brief for this goalkeeper. If we go down to penalties, you're going to be aiming in this corner. It's already done deal. So the decision's already made, and so he's not thinking too much. He's just thinking of keeping calm and just delivering what he's already been doing many, many times. And so a lot of times when they miss the penalty all over the place is because there's a lot of decision overload, right? And so a really, really important thing is one of the things, if you Google something called SPOF Radiology, is another system we developed on just a mnemonic on how to pick up commonly missed things on cancer patients. It's a review of work I'd done, and so it's something that you will find very useful. So let's summarize those 5 habits, right? These habits take time to develop, and if you stick to them, your overall risk will go down. Individually, may not, but if you put them together, you will be generally a good radiologist who can manage distraction. This is a very big source of errors. Managing your blind spots, reducing bias in reports, not rushing, because you don't need to rush. Right? If you've got a good system, you don't need to rush. Rushing often happens because you've been interrupted. Now you've got less time to do the same thing, and you think, well, I'm going to start all over again. And so, really, you want to give your mental, cognitive load a break, so then you can focus on the more important things. If you have any questions, please feel free to email me. on my NHS or the radiology seminars email. Here's the kind of the details to this article, and it's a fantastic turnout, and I hope you found it useful, and it's something that we have found, my colleagues have found, is really, really useful, and regardless of what you report, right? Regardless of what you report, you'll find this useful. Any questions? No questions. Fine. So, excellent. I'm just curious, where are people based? Because obviously we had loads of people attending. Any advice on people who are disproportionately interrupted? That's a really, really good question. Number one, as I said, is you've got to be proactive about it. So, and especially the other thing is, a couple of things is depends what you're doing, right? In terms of distraction. Number one is accept distraction. That's a it's a strange thing from a radiologist to say, right? You've got to accept it. Now, because if we get rid of distractions, it means that we are more easily replaceable, right? So I like distractions in that sense that my job is secure, right? Somebody's coming to ask me. This morning, the surgeons came down. They said, well, they wanted me to go through different scans with them. Patients really unwell on ITU. Can you look at this? Can you look at that? I like that, right? Although I was in the middle of something really important, something else, but actually I like that because that means my physical time is valued with them. My interaction with them is valued. So that's one thing. Also depends on what you do. So certain times you cannot reduce. And if there's an environment you can create where, for example, if you're doing call reporting, my phone is because of multiple hats I wear, I get my emails and phones are always constantly bothering me. So I will switch those things off for a specific power reporting time. So that's something you can do, is you have what we call a power reporting time. So for example, most people are able to report, depending on what your reporting workload is like, you can do a lot of your work in much tighter time, right? And so you can actually do some power reporting, switching everything off, escaping and being uncontactable. That's a really good way of doing it. If your reporting session requires you to be interrupted, then have a system. Often what I do on my door is I put this little thing up. If depending on is you can do that. So for example, please, I will be a couple of minutes before I address your query, something like that, right? And I try and so those things. If your phone keeps ringing, right? Because that's another annoying. I've got a phone. Is my NHS phone constantly ringing? So what I definitely find very useful. I've got I'm going to find my stack of post-it notes, right? Write down to kind of help. But remember, all those habits are linked, right? You can't do them one on their own, right? And it takes time. It takes time to build these habits, and I can assure you, it will save you so much anxiety and stress later on. And you can also try other things that you might find useful. The idea of this paper or of this article was essentially just to get that conversation going. Right? I remember as a trainee, most consultants I would sit with, they would just be really. See, radiologists have a really bad reputation amongst non-radiologists of being grumpy, being the most, before I went into radiology, I used to dread going to radiology departments because they would hate you going in there. You knock on the door and you get this like, what is it, kind of thing. And the reason is because they think they've suddenly been interrupted for the first time, and they're like, oh, I've been interrupted, like that wasn't meant to happen. And so we need to embrace the interruption. It's just we need to figure out a way. Now every department is different, every place you work is different. And somebody's asked me, do you not think the 2-minute thing's a bit odd? I can assure you the 2-minute thing, no matter how urgent it is, I've tried it, right? It sounds odd, right? But I do it all the time. Now I do it all the time, even when I said, can you call me back? And if it's, no matter how urgent it is, 2 minutes, nothing's going to happen unless they are requiring you to do CPR. And thankfully, the radiologists never do CPR. Generally, they're not going to call you to a crash call in CT scanner. right? If that's the case, they'll come and say, it's really, they'll probably just shout it out. Generally, I find that people are willing to wait 2 minutes, right? Because if you were a clinician on the ward, middle of speaking to a patient, they wouldn't interrupt you, no matter how urgent it was, right? If you were, if a surgeon was examining a belly of a patient, and you wouldn't just say, I want to speak to you. You wouldn't just barge in. You'd say, and you'd probably say, the surgeon might say, just give me 2 minutes, let me finish my examination, right? And so they'll scan, they'll do, yes, what is it? What can I do for you? Oh, I've got an urgent case to discuss. They wouldn't mind, but it's just normal courtesy. And I think I've so far not had any pushback. In busy clinical, how can radiology balance speed and accuracy without increasing the risk of diagnosis? Exactly. So the system is really, really important, right? Having a solid system of being able to, because remember, again, this is unrelated, kind of off-piece, is errors generally in medicine, not just radiology. There's a strong correlation in number of decisions you make and the errors. Now imagine you're having to make so many decisions, right? By the time your critical decision needs to be made, you've got decision fatigue, right? It might be that you need to figure something out on a complex scan. You've already made a million decisions of this and that, and so your mind is done, and not necessarily just in radiology, just doctors as general who are on the wards, who are operating, and they're spending time on random things. So by the time the most important decision comes, you've got decision fit, and you've made, like, somebody did a kind of a process mapping of number of decisions people make, and there was something like 90 or 100 decisions are made by the time something a really important decision is made. And so you want to reduce that cognitive load, and all those things really kind of are interlinked, and having a system is really, really helpful in that. And the other thing I find is that speed comes with a good system. Now but that speed takes a little while to get. You might find that the system takes a little bit of oiling, right? And I wouldn't worry, right? Because once you get your system, I'll tell you what a system is really useful for. For example, we've got a system which you constantly, when I'm looking at CT head, I've got a way of doing it, the coronal at a specific time, sagittal at a specific time. If I get interrupted, I know I haven't done the sagittals yet, so I know I'll go back to it. Because even if it's a perfectly normal scan of a 20-year-old with headache, and you know it's a normal head, I will still make myself do the normal thing, because I know that it's not for now, it's for later. That practice now is not for now, it's for later when I really need it. So, and that's really the key. How do we, as students, build confidence in imaging interpretation without becoming overconfident, missing important findings? Now, part of that is knowledge as well, right? So the cognitive gap is also in knowledge. Because if you don't know something, you're going to miss it, right? So, and then the knowing, the fear of the unknown will slow you down, and then it'll lead to then overcalling of things because you're a bit too scared of not saying something, or a very wishy-washy report. So I think knowledge is really key. You've got to read. Radiology is a specialty which you cannot escape reading, right? It's a specialty which your knowledge is laid bare for the world to observe, right? And so if you've got a lot of gaps in your knowledge, it will be for everyone to see on that report. So really, unlike other specialties, everything you've got to CPD, right? But I take this very personally. I spend a lot of time just reading, right? Reading and updating the knowledge, figuring out I actively do, look at good reports. I quite like that. I'm going to adopt it. You've got to constantly keep doing it to fill up your cognitive gaps through knowledge and also your visual aspects of that. Regarding CPD certificates, I think that they will be sent out. The admin team should organize that for you. I think they'll send out a QR code or something. If you fill that form out, they'll send that to you. Fine. I think I've answered most. I've answered. Yeah, somebody is focusing only on the consultant's clinical notes also leads to missing finding. Exactly. Yes. The thing about the satisfaction of search is a big one, and for example, and if, for example, you get family calling, right? It's normal. Normal. Your family might call you in the middle of a reporting session because they need something important. Well, they can wait 10 minutes usually, right? So if my wife sometimes calls me because she needs something, I've forgotten something. Normally they know not to call me when I'm at work. So when they call me, I think it's probably usually important. But I'll tell them if I'm in the middle of the scan, just give me 10 minutes unless it's really, really important. They say, okay, fine, I'll call you back in 10 minutes. So those sort of things, it's a habit. It's not going to happen straight away, but it's something you just got to ingrain in yourself. Habits don't happen, but these little things together will overall reduce the risk and let you sleep. And I like my sleep, and so I want to be able to sleep easy. Okay, I think that's everything. Thank you very much, and take care and have a nice evening.